have the slides up, please?
Good afternoon. I'd like to thank SAGES for the opportunity to present to you today. I'm here to speak to you about a novel finding that B-type natriuretic peptide, or BNP, increases after gastric bypass surgery and correlates to weight loss. These are my disclosures. Heart disease remains the #1 cause of death in the U.S., with over 300,000 deaths yearly. Two primary modifiable risk factors are obesity and smoking. However, as smoking rates have gone down, obesity rates were increasing. Increased BMI has been linked to an increased risk of MI, and in fact, national obesity rates look a lot like cardiac death rates. Gastric bypass has been previously shown to improve biochemical risk factors 1 year postoperatively, including lipids, fasting insulin, and markers of inflammation. However, our search for markers of cardiac disease continues because it is often difficult to assess cardiac function in the obese individual. Exercise intolerance limits the use of stress testing. Their body habitus can become a problem in echocardiograms. And moreover, it is well known that MIs occur in 50% of individuals despite normal cholesterol. This leads us to look for other tests. Over the past decade, BNP has become a useful diagnostic marker, particularly in the setting of CHF. BNP is normally released by the ventricles as a compensatory response to increased cardiac pressure or volume. Physiologically, BNP regulates fluid overload by promoting diuresis, natriuresis, decreased sympathetic tone, and decreased ADH and aldosterone production, with a net effect of decreasing preload and afterload. As such, BNP has been shown to have a relationship with plasma volume. BNP is particularly useful in obese individuals who present to the ER with symptoms of CHF, which may be due to exercise intolerance or peripheral edema. More recently, BNP has been shown to have metabolic properties. In fact, studies have shown BNP increases insulin sensitivity, promotes lipolysis, and may increase leptin. BNP is directly correlated with adiponectin, another important metabolic regulator, and is low in obese individuals. Although it is well known that in CHF, high levels of BNP correlate with weight loss and eventually the phenomenon known as cardiac cachexia, no one has demonstrated the effect of intentional weight loss on BNP. Therefore, our hypothesis is that surgically induced weight loss will lead to a lower BNP. Will lead to an increased BNP. Our primary outcomes were BNP, percent excess weight loss, and plasma volume. 101 consecutive patients undergoing LAP Roux-en-Y gastric bypass were included. Any patients with a history of CHF or chronic kidney disease, conditions which directly influence BNP, were excluded. BNP was measured at pre-op and 3, 6, and 12 months postoperatively. Secondarily, we examined parameters to determine predictors of BNP change. The clinical characteristics of our participants were typical of a bariatric population. There are 3 patients with CHF who were excluded from our study. Here you can see the BNP ranges routinely used to rule in or rule out CHF, with less than 100 being normal, 100 to 400 indeterminate, and greater than 400 highly probable for CHF. Please note, before surgery, only 1 patient was indeterminate, and postoperatively, there were 24 such patients. At no point during our study were patients in the high probability range for CHF. Of note, the 3 patients who were excluded from our study also had significantly increased BNP concentrations postoperatively. This figure demonstrates, as expected, significant decline in BMI, which is the blue line, while BNP, which is the green line, rises dramatically. As you can see, there's a near 3-fold increase in BNP. In addition, our patients had a concurrent decrease in BMI from 46 to 32. These changes were both statistically significant. This table demonstrates our multivariate linear regression analysis, which shows that the only significant predictor of BNP change was excess weight loss. In our study, there was no correlation between changes in BNP and plasma volume. In conclusion, Roux-en-Y gastric bypass leads to significant increases in weight loss and BNP. BNP change is only correlated to weight loss, not plasma volume. These findings suggest that BNP may be an additional mechanism by which surgically induced weight loss occurs. Thank you.